Hello.
Hi.
How are you doing today?
I'm fine, thank you.
Good. My name is Brooke. I'm going to be your nurse today.
Hi, Brooke.
And we'll be doing a neurological assessment. But first, I just need to verify that I have the right patient here. Can you verify your name and date of birth?
Allison Schneller, September 20th, 1985.
Perfect. Your wristband matches my records here, so that is great. If at any time you feel uncomfortable or have any questions, please stop me and I'll answer those questions for you.
Okay.
So right now I'm just assessing you. Your posture looks really good. You're sitting nice and erect. I don't notice any involuntary movements at all. You are appropriately dressed for the weather. It's quite warm outside. You're in shorts and a t-shirt. That is great. You're well groomed, not disheveled in appearance at all. You appear a little bit anxious, but happy overall. And anxiety comes with these type of assessments. Do you know what date is?
July 6th, 2013.
Perfect. And do you know how that I came here today?
I drove in your car.
Yep, exactly. And the President of the United States before Barack Obama?
George Bush.
Perfect. So that was just checking your recent and your remote memory, which are all very good.
Okay.
Your verbalization is coherent and logical, so that part of your neuro assessment looks really good.
Good.
The next thing we'll do is we'll move on and check your cranial nerves. The first cranial nerve is your olfactory nerve, and what that one is we just would check smell. We're not going to do that today, but have you noticed any change in your sense of smell?
No.
No? Okay, sounds good. And then the second cranial nerve is your optic nerve, and typically how we would check for that is we would do a visual acuity test, and then we would also check peripheral fields as well.
Okay.
Okay? Do you get regular eye exams?
I do.
Okay, great. 3, 4, and 6, which is your oculomotor, your trochlear, and your abducens, are all cranial nerves that I'll check by doing an eye exam. So I'm just going to start that right now.
Okay.
I'm going to shine this very bright light into your eyes, okay?
Mm-hmm.
What I'm looking for is that your pupils constrict with the light, which they do. And I'm looking for both, not only direct, but also consensual. And then I'm going to have you just follow my finger here. And looking in. And then, good. So your pupils are equal, round, reactive to light and accommodation.
Okay.
Okay? The next thing I'll do is cardinal position. So I want you to look straight at me. I don't want you to move your head at all. And I just want you to follow my finger. Great. I don't notice any nystagmus or any deviation of your eyes. Sometimes with your far out glance on your horizontal axis, you can have a little bit of jerkiness, but I didn't notice that at all, but that would be a normal finding.
Okay.
Okay? Next I'm going to check cranial nerve 5, which is your trigeminal nerve. And that one actually, I'm going to have you clench your teeth real hard, and I'm just going to check here, and then clench. Very good. And then I'll use my little cotton swab here, and I'm just going to very gently touch you. And I need you to close your eyes, and then you tell me where I'm touching.
Okay. The left side of my forehead. Left cheek. Chin. My right side of my chin. Right cheek. Right forehead.
Perfect. And then the next cranial nerve is actually cranial nerve 7, which is your facial nerve. And to check that one, what I need you to do, we're going to do a whole bunch of different faces together, okay? So if you can smile for me real big, show your teeth.
And my retainer.
Yeah, on your retainer, you're going to frown, put your eyebrows up real high, puff out your cheeks, and then you let the air out. Very good. 8th cranial nerve is your acoustic nerve.
Okay.
For this, what I'm going to do is I'm going to say a few words. I'm actually going to whisper them. I need you to plug your one ear, and then we'll repeat it on the other side.
Okay.
Okay? So, computer, baseball, flowers.
Computer, baseball, flowers.
Perfect. And the other side? Computer, baseball, flowers.
Computer, baseball, flowers.
Perfect. And then cranial nerve 9 and 10. Cranial nerve 9 is your glossopharyngeal, and cranial nerve 10 is your vagus nerve. what I'm going to do is I'm going to shine this light in your mouth and I'm going to have you open up and say ah. I'm looking at your uvula. Your uvula rises up and it's in the midline. Your tonsils are quite swollen.
I'm getting over a cold.
Okay, sounds good. I would definitely follow up with your primary physician.
I will.
Okay. And then your voice sounds a little bit hoarse, but you just said you were getting over a cold, so I think that's probably fine. Now we'll check cranial nerve 11, which is your spinal accessory. Okay? If you can just raise your shoulders, shrug them, and then you're going to push, and then push. Very, very good. All right. And then lastly, all we need you to do is stick out your tongue. Perfect. And that checks your hypoglossal nerve.
Okay.
Any questions with your cranial nerves at all? No? Okay. Now what we'll do is we're going to check your motor function.
Okay.
I'm going to have you just grab and squeeze my fingers. Perfect. And then if you can just push down. And then, don't let me push you down. And then push. And then pull. And then pull up. And then push down. Very good. So we're checking plantar flexion and dorsiflexion of your feet.
Okay.
Everything is equal, symmetrical. I don't notice any variances in your strength in any of the areas we just checked. Now what I will be doing is using this little thing. This is just going to be pain or dull. Okay? I'm going to check several different areas on your upper and lower extremities, and I just need you to close your eyes and tell me what you are feeling. Right. Okay?
Pain. Dull. Pain. Dull. Dull. Pain. Dull. 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 Pain. Pain.
Perfect. Very good, Allison. Do you have any questions about that one at all?
No.
Everything looked very normal with that. And that was actually checking your posterior column tract. Okay? Now, moving right along, that was checking your spinal tract, not your vibration is what we'll be checking next. This checks your posterior column tract. Okay? So what I'm going to do, I'm going to use this tuning fork. I'll be placing it on your bony prominences, and then upper and lower extremities. Tell me when it starts, and then when you can't feel it anymore.
Okay.
Oops.
I feel it. Stop.
Okay.
Feel it.
Kind of a long one.
Mm-hmm. Stopped.
Okay. And then I'll do your elbow.
Feel it. Stopped.
Okay. And we'll do the other side.
Feel it. Stopped. Feel it. Stopped.
Okay. And then on your elbow here.
Feel it. Stopped.
All right. Now we're going to move to your toe.
Okay. Feel it. Stopped.
Okay.
Feel it. Stopped.
Okay.
Feel it. Stopped. Feel it. Stopped. Feel it. Stopped. Feel it. Stopped.
All right. Great. The next thing we're going to do, I'm going to have you close your eyes. I'm going to put an object in your hands. This is called stereognosis. I just need you to identify what I'm placing in your hand.
Okay.
Okay?
It's a key.
Perfect. Very good. All right, moving on to your reflexes. So we'll check your upper body reflexes and then we'll move down to your lower. Okay? So I'm going to start with your your biceps. And try it one more time here. Just relax. There we go. We'll do.
I'm gonna make you do all the work. I'm not even gonna lift them up.
Okay, sounds good. Very good.
See what happens?
When you just relax. All right, this is going to be your triceps. Very good. Relax. There we go, very good. All right, now I'm going to do your patellar. So I'm just going to find that kind of fatty pad, and I'm just going to try it again. Okay, just a very minimal reflex. And try this other side here. There we go, that was a good one. Now we'll do your Achilles reflex here. Very good. Very good. So your reflexes, I would give them a +2, which is normal all around. This patellar one was a little bit down, but I think that you said that was pretty normal for you to not have great reflexes.
Normally, when I go, I don't get hardly any reflex.
Okay, great. So now I'm going to ask you to step down here. Just be careful getting down. I'm going to have you stand here and just do this for me. So this is checking your cerebellum function, okay?
Okay.
Now you can put your arms down at your side. I'm going to have you close your eyes, and I'm going to just hold my arms around you. This is called the Romberg test, and you are standing nice and still. You're not swaying back and forth, so that is great. I'm going to have you walk to the door and then turn around and walk back to me. I'm going to watch your beat. Looks great, and I don't see any variance in that. So that concludes our assessment. I'm just going to wash my hands. Do you have any questions at all?
Nope, not today.
All right, thank you very much.
You're welcome.